welcome, Dr. Katie.
Thank you.
Dr. Katie Tredo is here, everyone. She's a doctor of physical therapy at Cultivate Your Wellbeing here in Mequon. Thank you so much for joining us today.
Thank you for having me.
So today we're going to be discussing how we collaborate with our services to best serve our patients, especially those struggling with gastrointestinal issues such as SIBO, which I will be highlighting at the beginning. And then we're going to have Dr. Katie talk to us more about what visceral manipulation is and how we both work together. Dr. Katie, why don't you tell us a little bit about yourself?
Sure. Thank you for having me on today. My name is Katie Tredo, and I'm a pelvic floor physical therapist and owner of Cultivate Your Wellbeing. Jenny Clower and I are at Cultivate Your Wellbeing, and we specialize in treating patients with the whole array of pelvic floor dysfunctions, from pelvic pain, prolapse, bowel and bladder issues, and any issue kind of through the pregnancy and postpartum period as well. I've been specializing in this for over 15 years and was initially drawn to this area because of the huge quality of life issues that we were able to address with our patients.
Yes, and I'm so glad that I met you. For those who don't know that are joining, I'm Dr. Meister. I work at Lakeside Natural Medicine, and I'm a naturopathic doctor. So thank you so much again for coming here, Dr. Katie. And as you all know, gut health is truly at the center of your health and well-being. And today we're going to be talking about SIBO. So SIBO is a gastrointestinal condition that stands for small intestinal bacteria overgrowth. And SIBO is a type of dysbiosis where there's bad bacteria overgrowth in the small intestine. Normally we should have bacteria in our large intestine. That's where it should be fermenting. That's where our main microbiome is. But in the small intestine, that's all about absorption of nutrients, and there really shouldn't be that much bacteria overgrowth there. And as a naturopathic doctor, I work with my patients to find their root cause. And many of my patients especially, are diagnosed with IBS, and they don't have many treatment options to help with their symptoms. But what the research has found is that about 60 to 80% of all IBS is actually SIBO. So it's a huge condition that we're going to get into. And some of the risk factors we'll walk through, and you can kind of do a self-assessment to see which one kind of resonates with you. If you are on this live and you are struggling with some gastrointestinal issues. So the main risk factor that I see often is low stomach acid. So with optimal gut health, any kind of pathogen that's on your food should meet their doom in your sea of stomach acid. Chronic antacid use, like using Prilosec or omeprazole, can cause low stomach acid and lead to SIBO. These medications are greatly used in times of gastritis when they really should be used, but they should only really be used for short duration. And often I see patients on these for years. Another big risk factor for SIBO is slow motility. SIBO is actually a lot of times a motility disorder where there's lots of constipation. And we're going to talk to Dr. Katie here at the end, and she's going to tell us about these physical aspects of SIBO and gastrointestinal issues and how they all relate back to how she uses physical therapy, pelvic floor therapy, and even her visceral manipulation. And then a few other risk factors that we're going to get through. We're not going to get through all of them, but just a few big ones. Is a history of food poisoning. And then the last one would be a structural root cause. So there's a history of abdominal surgery, like a C-section, where there's scar tissue. There's an abdominal injury in your history, or you've had a history of a bowel obstruction. These can all lead down the line to SIBO. So some of the symptoms of SIBO is lots of gas, belching, and bloating. And these are all a result of poor digestion. So poor digestion is basically fermentation of carbs or sugars that you're eating in your small intestine. Constipation, again, if you're not having 2 easy bowel movements a day, you're probably constipated. Other signs of constipation can be incomplete bowel movements, hard stools, and we'll get into that a little bit further. Diarrhea, again, too fast a motility can also be part of the SIBO picture. Abdominal pain, malabsorption, so maybe you're low in some nutrients or you have anemia. This is due to chronic inflammation in your small intestine, where that's where we absorb most of our nutrients. So if there is a lot of inflammation, you're not going to absorb as many of those nutrients as you normally could. And heartburn can be another sign. So testing options. To look at the small intestine, we have to do a breath test. So we'll do a lactulose breath test normally, and then we'll look for methane or hydrogen gases as there's two different types of SIBO, the methane dominant or the hydrogen dominant. And we have lots of natural ways of treating SIBO. So it kind of combines a lot of different lifestyle and dietary changes, but often we combine a low FODMAP diet. So if you've ever heard of a low FODMAP diet, it's essentially, it's a big fancy word for fermentable carbs. So fermentable monosaccharides and polyols. So essentially fermentable carbs are sugars that are found in your foods that cause lots of those gas and bloating symptoms that the bacteria can basically feed off of in your small intestine, which causes a lot of your symptoms if you have SIBO. And some of the top FODMAPs include garlic, onion, beans, cauliflower, mushrooms, and apples and sugar alcohols. Sugar alcohols you're going to find in keto products like anything with like xylitol or erythritol ends in OL. So if you notice some triggers to those different foods, then SIBO may be part of this picture. And if you did test positive and you did well on a low FODMAP diet for SIBO, then we have 3 different ways of treating this effectively, naturally. So one way is an elemental diet, which is a liquid diet for 2 weeks. The second option is herbal antibiotics. So we can use allium, a constituent found in garlic that's safe in SIBO. We can use neem, oil of oregano, lots of different antimicrobials to help clear the infection. And these 2 options are just as effective as regular antibiotics. But if it is indicated, then we will switch to antibiotics actually and work with your GI doctor, or we have Mackenzie, our nurse practitioner, work with us to help collaborate with prescribing these medications. And rifaximin is actually one of the antibiotics that we use, which is actually a good antibiotic when we just kind of put all the antibiotics on a scale, because it actually helps to increase good bacteria in your gut. It's not associated with antibiotic resistance, and it's not well absorbed, so it stays in the gut. So naturopathically, it's kind of an approved antibiotic. And so after we treat the SIBO, the goal is then to prevent relapse. SIBO can be a chronic condition. A lot of my patients who have been struggling with IBS have been struggling for years until they got help. And research shows that most people with IBS aren't actually reaching out for help. So our goal is to, once the gut's cleaned up, to stay that way. And we have lots of different natural ways of supporting this process. A big part of this process is supporting your stomach acid. Again, your stomach acid is antimicrobial. It helps protect you against pathogens like that contribute to SIBO. And so we would want to do mindful eating practices, bitters, avoiding cold water with meals, and even digestive enzymes when they're indicated. And then we also want to support intestinal motility. So supporting our gut's migrating motor complex, it's basically the complex that keeps our bowels moving, keeps everything nice and natural. We can use prokinetics to help with that, so things that help speed up the stool along that should be moving in the right direction. We can use fiber, dietary sources of fiber, and then we can also use ginger and meal spacing. And we always want to support the gut's immune system in this process and healing. So bone broth, so good, so high in L-glutamine, which helps to heal your gut, and other anti-inflammatories and probiotics going forward. But a lot of the times these issues become chronic, and SIBO treatment and recovery can take months depending on the case. So preventing the recurrence is what we want to work on. And if it is recurring often, I often refer my patients, Dr. Katie here, for visceral manipulation to help assess any physical aspects to why the SIBO is happening, especially when there is methane dominant SIBO with chronic constipation, incomplete bowel movements, especially with any history of abdominal surgery that we talked about, any history of abdominal injury, or any history of small bowel obstruction. But these aren't just it. And Dr. Katie here is going to go through, all the indications for this. But why don't we bring Katie in now, and why don't you tell us what visceral manipulation is?
Sure. So as you touched on, in a lot of these patients, there's decreased motility through the gut. And visceral manipulation is a specific technique that addresses the mobility and the motility of the gut itself. So it's looking at those attachments within the organs through gentle, specific forces. So at the advice of my early mentors, I began my training in pelvic floor therapy and visceral manipulation simultaneously. And honestly, it just has helped form my treatment approach, and I can't imagine treating one without the other.
Mm-hmm.
The first time I went to a visceral class, which some of you might be thinking this seems a little woo-woo, I was too. I expected to walk out thinking everyone was crazy. And instead, I left absolutely amazed that in all of my training and PT schooling and the multiple cadaver labs I had studied, we kind of moved the organs aside as PTs, and we studied the muscles and the nerves and the skeletal system. And instead of thinking everything was crazy when I left, I was just could not believe that I had never considered the organs themselves or their attachments as contributing factors to my patients' musculoskeletal symptoms or even their body's mobility.
Mm-hmm. How do you feel like it enhances your pelvic or physical therapy treatment?
Sure. So physical therapy has a lot of different tools in the toolbox. So it's one of the things I use within physical therapy. And a lot of times patients that benefit from visceral manipulation may have had, pressure in their body somewhere or pain that hasn't been addressed with other techniques. I get a lot of patients from other physical therapists who have tried everything in their toolbox musculoskeletally, and they can't figure out why they can't get this end range of shoulder motion or why the back pain is persistent. And so I feel like it's just a whole nother view of looking at how the body's moving.
Yeah, and I think the example of the shoulder and the gut, and how do you find that gut issues go back to other areas of the body?
Sure.
Like
yeah, so sometimes it can be a referred pain. So organs all have muscle or pain referral patterns as well. Other times it can be very structural, like a restriction in the liver or the diaphragm, and then not being able to flex your right shoulder completely. It could be as easy as that the physical ligaments and fascia there are what is restricting that shoulder range motion.
Yeah. A lot of my patients have had pelvic floor therapy before. And a lot of the times when I'm talking about visceral, they want to know, is that the same thing as visceral manipulation, pelvic floor therapy?
Sure. We hear this a lot too when patients come in here. A lot of our patients have tried pelvic floor therapy elsewhere, and anybody who's tried pelvic floor therapy at more than one place can tell you that there's a huge range of skill sets and focuses within pelvic floor therapy. So the visceral manipulation is just a tool within that pelvic therapy that I use. And the biggest thing with this is it teaches us to listen to the patient's body versus a lot of techniques where the therapist is directing the treatment, or maybe during the initial intake has ideas of what they're going to check. Of course, we do that too, but putting our hands on the body and listening to where those fascial pulls and fascial restrictions are is truly what guides our treatment. And that approach has changed the way I approach all of my treatment techniques.
Yeah, that's where I find that we both relate together, and that we're both finding that root cause. It's not always where where the symptoms are, what you're kind of saying. And when we think about pelvic floor therapy and visceral manipulation, how does that help someone with constipation?
Yeah. So constipation, as you know, has more than one factor. A lot of times I get patients referred here for constipation, and their idea is that it's fully a pelvic floor issue. However, our pelvic floors need to be relaxed. They need to be coordinated. We need to be able to physically have that bowel movement, but it's rarely the only issue. And oftentimes, as you talked about before, we have to work on that motility from higher up in the body as well. And so from a physical therapy standpoint, with all of my patients that come in with constipation, I'm going to look at posture, breathing pattern, general mobility, lifestyle, diet, all of these kind of things in terms of their pelvic floor. And then also, if they consent to a pelvic floor exam, what their muscle tone is like, what their strength is like, and really importantly for constipation, are they able to relax those muscles and coordinate them for a bowel movement? And then by adding in the visceral manipulation techniques, we're listening to where that person's restrictions are. And as anyone on this that does have visceral manipulation or is a patient of mine, sometimes you'll come in and that pain is in the right lower quadrant, but we're finding things in the left upper quadrant that are where your greatest restriction are. So we really listen to your body's tissues and address those restrictions from higher up, which can make a huge difference. A lot of my patients that are coming in for constipation, they'll hear a lot of gurgling in their stomach when they come in. They might feel a decrease in like bloating or abdominal pain. Sometimes just like a calmness of their body. And then oftentimes I get an email or a text a few days later being like, I've had great bowel movements the last few days. So those are always the best messages.
Yes, yeah, exactly. So what does the first appointment look like? How do you typically, and how often do you see someone?
Sure. So the first appointment always starts with kind of a patient interview. We review symptoms, history. I truly believe the focus for Jenny and I at Cultivate Your Wellbeing is listening to a patient's story. I think patients are intuitive to what's going on in their own body. They sometimes are in agreement with previous diagnosis, sometimes not. But I find a lot of value in that conversation to get our session started. And then we'll look at, things like posture, general movement patterns. I'll feel over the abdomen and the pelvis to see, looking for these visceral restrictions. And then if they consent to a pelvic floor exam, that'll be part of their initial session. Sometimes that comes in later on, depending what they're coming for. Usually we start with treatment once a week. I rarely see people more often than that because I truly think a lot of this comes down to habits and lifestyle at home as well. And I really like to enable the patient to take care of their care in between sessions. If someone has severe symptoms, as you said, like some of your patients that have just had this chronically, or they have severe pain, usually we'll stay at weekly sessions for a while. But sometimes I have a patient, I just evaluated one from you the other day, who is doing pretty well, and she just needs the visceral manipulation piece, and I'll see her every 2 to 3 weeks. Because the cool thing with visceral manipulation is you kind of get the body moving, and then your body's innate motility will take over, and they should continue to see improvements during that time.
Yeah, that's why the combination is just so important to me, and that's why I'm so glad that I found you and that we're working together. Tell us a little bit more about the indications for visceral treatment. You kind of went through it a little bit, but are there other things other than SIBO that you'll see for this?
Sure. So a visceral restriction refers to any decrease in mobility of the organs themselves. And so when an organ loses its ability to kind of slide or move past other structures in the body, so if you think like taking a deep breath, everything in our abdominal contents kind of has to slide past each other to not have an issue. When things don't slide past each other, we can feel pain or symptoms. So any kind of restriction, or you've kind of run out of other options of things you're doing. But the more obvious things are like endometriosis, surgical scars, and then oftentimes these lesser restrictions can occur because of any kind of inflammation in the body. We also see, we're a pelvic floor practice. We see a lot of pregnancy and postpartum. And there's patients that had a baby 5, 10, 20 years ago that come in and their ribs are stuck flared, or they have these restrictions in their body. And when we're pregnant and the baby is growing, our organs kind of get pushed to the side and moved around. And oftentimes we'll see that those restrictions kind of maintain afterwards, and these patients do really well with a little bit of hands-on treatment. So I have loved collaborating with you, Dr. Meister. We have seen so many patients together, and I truly feel like I see such great results in our collaboration and kind of that complementary treatment style. So we are thrilled that one of our mutual patients, Erin, was willing to come on today. And we're adding Erin in now to tell us a little bit about, Erin, if you could share your story and kind of what working with the two of us together has done for you.
Yeah, absolutely. Thank you for having me. Good to see both of you.
Good to see you.
So just for context, I'm 42 years old. I have two children. I have struggled with endometriosis since I think I got diagnosed in my early 20s. And I had a ton of pain from that, and I guess did not realize that that's what it was initially. And so, like a lot of other female issues, it was kind of like, let go, you just have to live with it. And then, so I got diagnosed and treated for that laparoscopically. They removed it. Thankfully, I was still able to have two beautiful boys. But since my probably late teens, I have really struggled digestively. And so when I got diagnosed with endometriosis, they said, well, you have IBS. And treated it with take some, I think they said Advil, fiber, and like be aware of what bothers you when you eat it. So, this has been kind of a long run of issues all in the same area. But then more recently, I actually ended up having a hysterectomy in my late 30s due to the endometriosis. And after that hysterectomy, there were complications with it. Actually started to bleed out in recovery. They had to go back in and do another surgery, blood transfusions, the whole deal. But after that, I really started to struggle even more digestively. And as both of the doctors have just mentioned, I had a lot of trauma in that area, obviously, but I'm sure, even though I wasn't educated about it at the time, a lot of scar tissue and adhesions were forming because of the trauma in that area. And I think I had a wonderful doctor, but I was never referred to any pelvic floor PT. I was never talked to about diet or anything else, even though my problems had continued and really gotten worse digestively, and like bloating, cramping, uncomfortable when I eat, really struggled. And by this time too, I was also on Prilosec. So we're talking about things that contribute to SIBO before. I feel like everything you're saying, I'm like, check and check. By then, I had been on Prilosec for probably, 8 or 10 years. They had also started me on a pretty heavy regimen of laxatives to help, which if anybody's taken them, you just have to continue to take more and more. They kind of lose their effectiveness. And so that's definitely a part of my story. And I know something that a lot of females don't want to talk about, but certainly was a struggle. And then about 4 months after I had that hysterectomy, was on vacation with my family in Florida, and my appendix ruptured. And so again, trauma in that same area. Unfortunately, that appendectomy, I sat so long with a ruptured appendix that I formed all of this infection. And then I had further complications and ended up with a post-op bowel obstruction from the appendectomy. So another check on the SIBO list. So then I also had a bowel obstruction, which after 20 days in the hospital and NG tubes and all kinds of other really exciting things, they ended up having to surgically go in to repair the bowel obstruction as well. I feel really blessed that I had great surgeons that did it all laparoscopically, so that I don't have a big cut like a lot of women do after a C-section, but they went in and out of those same holes, I think 6 times in like 6 months. So there was definitely a lot of trauma to that area. And again, when I left the hospital, I was never referred to pelvic floor. I did have like a consult with a nutritionist when I left, because by then I had gone about a month with no food by mouth. I was being fed through a PICC line in my arm. So I did get, and I had to be on a liquid diet for about 4 months after that. So, there was all these other things going on with my body, and I did have some initial consult, but nothing that ever really taught me about all the things that either doctor were explaining today, and especially about what that scar tissue would do is in terms of restricting my body's ability to be able to like properly process food, or what was happening with things like my pelvic or other muscles that I love to exercise. Like movement is my medicine. And I was really struggling to be able to get back to any kind of fitness that didn't really cause I had so much pain I had never, ever had before. And so I felt pretty stuck, to be honest with you. And then almost to the end of how I met these two, but basically I had been to kind of the other traditional approaches where I'd gone back and said, something is not right. I can barely eat without being so uncomfortable. I am bloated. I still, like, even with being on Prilosec, my heartburn is horrible. There's not enough laxatives to take care of any like belly issues that I'm having. I don't feel like I can exercise properly. Like, help. What can I do to help myself? And a lot of times, unfortunately, the answer was more medication and not ever really looking at the root issue of what my problems were. So thankfully, my mom had knew somebody that came to Lakeside Natural Medicine, and she said, okay, like, why don't you give it a try? And I'm so incredibly thankful that I did. Because I did get diagnosed with SIBO. And with that, I'm so proud to say that I'm off. I am off my Prilosec, and I'm working my way off laxatives and trying to get my SIBO under control. And in order to keep it under control or hopefully make it go away permanently, that is where the visceral manipulation and pelvic floor therapy has come in, because I have significant motility issues. One of the things I guess that I've learned is that when you have trauma or pain in an area, your brain tells your body to turn those muscles off. Stop working, there's a problem, right? And so thankfully now I'm getting the insides healed for my SIBO, and at the same time, Katie is helping me to get my muscles to work properly again, and not, believe it or not have everything be so tight and clenched. And there's just so many things that you can do to, I think, if anybody who's watching feels sort of helpless in their situation and wants to regain that feeling of like just being willing to help yourself, this team will absolutely do that for you, because so encouraging. So have put up with my like tears at sometimes where I feel like maybe this is not ever gonna go away or get better for me. You know, although I joke about feeling old sometimes, I also think, like, I'm only 42. I have a lot of years left to be active and busy and want to feel healthy in my life. And I have 2 active growing sons. I want to be active with them. You know, and a mom and a wife that can pick up and go with my family and feel vibrant and ready to roll. And I feel like both of the doctors have really helped me feel like that's possible.
Thank you so much for sharing that, Erin. I think that I'm sure a lot of people can resonate with just a lot of different things that you were talking about. Just, I know, like everyone has something, you know, and I think that your dedication and you were steadfast, you didn't give up, you kept looking for the cause. And I think like each day you're realizing how strong you truly are, and how you can, you know, wean off of Prilosec and still be okay. And like all those different things that you were talking about were huge milestones for you to like get through. And so thank you so much for being here and sharing with that. That was awesome.
Yeah, thanks for having me.
Alrighty, so I I'm going to ask if there's any questions. I don't know if there is any or not. I'll leave Erin on here in case anyone has questions for her too, or us. We'll just wait around for a few more minutes and then we will head off. So we'll just wait one more minute in case there's any other questions. And then I think we're good.
I do have to say too, just last thing, if anyone is afraid because, you know, the manipulation, you think like, well, there's already so much pain there. I'm not looking for for more discomfort. It's such a gentle process. It's so calming and so gentle that just don't hesitate to think like, oh, well, you know, it's not like going to the gynecologist or anything else. It's a very different experience if like an internal pelvic floor work needs to be done, and anything that's done externally is so it feels like a little like spa trip sometimes because it's so gentle and calming on your body. So just if anybody has fears about that, it's not warranted. You'll be taken care of.
Yeah, that's good to know, because I think that some people may think that, oh, it must be going in deep or releasing that. I don't know if Dr. Katie, you want to discuss more of that?
Yeah, so that is a concern of a lot of patients that come in here, and some of them have had that experience, whether through it's a medical exam or with another PT. There's just such a wide range of skill techniques, and I think what visceral manipulation has done for all of my PT skills is instead of like feeling like you have to press hard to feel something, you're really using your hands to be receptive and feel back from the body, and it is completely transformed how I feel like my touch has gotten lighter through that. And you know, we all have these learning curve, and I go back to 18 years ago. There's patients that pop to mind, and I'm like, wish I knew this then, you know?
Yeah.
So I'm glad this has been your experience, Erin.
Erin, have you ever done a pelvic floor? I mean, like, you don't have to go into that either, but when we were talking about that, like, did you have any, or even physical therapy, have you gone to physical therapy before and thought it would be different or anything like that?
Yeah, I did really briefly after just my younger sister actually happened to have a best friend who's a pelvic floor physical therapist, and she said, your sister needs to get in there. She's had all this, you know, trauma to that area. She needs to go in and have someone help her. And I did go to somebody who did not do visceral manipulation. Like, it was not like this. It was more of here's a breathing exercise, which some of that is absolutely part of it. But there was no work on like the adhesions and really working on the fascia, and to help with, I think, a lot of the scar tissue that's formed. And so while initially it did help me get back to being able to feel like I could exercise, it wasn't enough because, as Dr. Katie will tell you when I came to see her, there's a lot to work on. But now the thing that I'm really aware of is how I can help myself when I come home. So if you are listening and you are somebody who finds themselves like I am constantly gripping my glutes or my upper abs when I'm standing, it's like bringing awareness back into your body, and learning what muscles should be working instead of the ones that you're now using. And to both of your points before, I do feel my brain and my body working together now to use the proper muscles versus just the things that it was using before. Like we're changing the feedback loop, I think, right? Of what should be firing and when it should be firing. So, yeah, it's not, like I do have to say, like, I live an hour and 15 minutes probably from both of your offices, and will gladly drive once a week to see either one of you. But right now I am to to see Katie for physical therapy. So it's worth every second in the car to learn what I'm learning and feel how my body feels when I leave.
Wonderful. Were you going to say something, Dr. Katie?
I was just going to say thank you, Erin, for being on here, because sharing your story is hard to do, but also you are the type of patient that really does all the work between sessions too. And I know for myself, and I'm sure for Dr. Meister as well, you've just been such an inspiration to us as well.
Mm-hmm. Definitely. Thank you so much, Erin, for being here. If you want to hop off, you're more than welcome to.
Thank you.
Thank you again so much. We did have a few questions. Dr. Katie, where are you located?
I am located in Mequon, which is about 20 minutes north of Milwaukee, and I'm located right off of Highway 43. So I have a lot of patients that commute from as far south as Kenosha or up in Sheboygan because of the location right off of 43.
Perfect. And do you accept HSA?
We do accept HSA. So we're out of network for insurance companies, but we take FSA, HSA, and provide your invoice that'll have all of our treatment codes and all that to submit for out-of-network benefits as well to your insurance company.
Mm-hmm. And to answer the question, for Lakeside Natural Medicine, we are located in Shorewood, right down near Milwaukee, and then we do accept HSA as well. And then the other question says, I have had all of the above and then some, but I am out of state. I believe my aunt is a patient. Who could I get in touch with for more information? So for Lakeside Natural Medicine, you can email us or call us. You can call us at 414-939-8748 or go to our website, link in the bio. The email is info@lakesidenaturalmedicine.com. And then for Dr. Katie, how can people get in touch with you for more information?
Yes, so our website is cultivateyourwellbeing.com, and my email is katie@cultivateyourwellbeing.com. If you are out of state, feel free to reach out. I've taken a lot of the visceral manipulation through the Bowel Institute and as well as pelvic floor courses, so I'd be happy to help you find someone in your state that may have a similar skill set.
Mm-hmm. And for us, Lakeside Natural Medicine, we do see people out of state virtually. So if that is you, we can see you virtually. And then we had a really nice comment. You ladies are wonderful. Thank you for all the information and inspiration. I believe the inspiration all goes to Erin, because I think she really did help inspire a lot of people here today.
We did.
All right. Well, thank you so much, Dr. Katie, for being here today and doing live with me. And we will see you next time. Thanks, everyone, for joining.
Thank you so much, Dr. Meister.